the key to cutting healthcare costs, reducing climate change and even saving lives could be to switch to vegetarian diet. Researchers have discovered that eating less meat could avoid 5.1 million deaths per year by 2050, cut planet warming emissions substantially, and save up to $1,000 billion. This study is the first to estimate both the health and climate change impacts of a global move towards a more plant-based diet. The research was carried out by a team led by Marco Springmann from the Oxford Martin Programme on the Future of Food. The Oxford University researchers modeled the effects of 4 different diets by mid-century. This included a business-as-usual scenario, one that follows global guidelines including minimum amounts of fruits and vegetables and limits on red meat, sugar and total calories, a vegetarian diet, and a vegan diet. Adopting a diet in line with the global guidelines could avoid 5.1 million deaths per year by 2050, while 8.1 million fewer people would die in a world of vegans who do not consume animal products, including eggs and milk. When it comes to climate change, following dietary recommendations would cut food-related emissions by 29%, adopting vegetarian diets would cut them by 63% and vegan diets by 70%. Dietary shifts could produce savings of $700 billion to $1,000 billion per year on healthcare, unpaid care and lost working days, while the economic benefit of reduced greenhouse gas emissions could be as much as $570 billion, the study said. The researchers found that 3/4 of all benefits would occur in developing countries, although the per capita impacts of dietary change would be greatest in developed nations, due to higher rates of meat consumption and obesity. The economic value of health improvements could be comparable with, and possibly larger than, the value of the avoided damage from climate change, they added. The value of those benefits makes a strong case for increased public and private spending on programs aimed to achieve healthier and more environmentally sustainable diets, Springmann told the Thomson Reuters Foundation. This study looked at regional differences which could be used to identify the most suitable interventions for food production and consumption, Springmann said. For example, lower red meat consumption would have the biggest effect in East Asia, the West and Latin America, while boosting fruit and vegetable intake was found to be the largest factor in cutting deaths in South Asia and Sub-Saharan Africa. Lower calorie intake, leading to fewer overweight people, would play a key role in improving health in the Eastern Mediterranean, Latin America and Western nations, the study said. But it will not be easy. To achieve a diet that sticks to common guidelines would require a 25% increase in the number of fruits and vegetables eaten globally, and a 56% cut in red meat. Overall humans would need to consume 15% fewer calories, it said. We do not expect everybody to become vegan, Springmann added. But climate change impacts of the food system will be hard to tackle and likely require more than just technological changes. Adopting healthier and more environmentally sustainable diets can be a large step in the right direction.